I'm Lisa Fitzpatrick and this is Bowie the Louchin. And I wanted to tune in today to talk about the town secrets. So working in a pelvic and sexual health clinic, we often hear women speaking about how their particular pelvic health issue feels like a town secret. It feels like something they've never told anyone. Sometimes not even their own husbands, sometimes not even their own girlfriends know about their pelvic health concerns. And what I wanted to say today is that your pelvic health and sexual health is important. It's a really important part of your well-being. There's no mistake and there's no surprise that Chinese medicine calls the pelvic floor muscles the muscles of longevity, and that the pelvic cauldron, as I call it, the pelvic basin, holds so many memories and impressions of past experiences. And when we are navigating some of these experiences, if there is a shame response, it's natural for a lot of women to not want to open up to their health providers and not want to open up to their nearest and dearest, sometimes because they're very private people, which is absolutely fine, and sometimes because they are feeling very, very alone and very, very isolated. And I wanted to just reassure you that no matter what you're experiencing, there is usually a really good opportunity for a solution and for various treatment options to be explored with you in a non-judgmental way with your fabulous women's health focused general practitioner or your pelvic floor your passionately committed physiotherapist who absolutely loves pelvic health and sexual health because it's become a focus point, a focal point, or a specialty for that particular therapist. There's no mistake why a lot of therapists get involved in this work, and it's usually because there is a deep, deep desire to hold a safe space for some of these stories to emerge, to be held with kindness and non-judgment, and to also be normalized in the exchange of information. So please don't feel alone. The chances are that your therapist will have heard something similar to your story. You are unique. Your particular story and your feelings about your symptoms are valid and should be taken seriously. And if you're not sure about whether you should be investigating your symptoms, or you've been putting up with some symptoms like incontinence or pressure heavy bulging, which might be related to prolapse, or pain with sexual intercourse, or issues that perhaps affect your ability to pass a bowel movement, I would like to reassure you that we are here, that there are plenty of passionate health and sexual pelvic health and sexual health providers out there that are ready and willing to take you with kindness, with no judgment, and with a lot of passionate knowledge and scientifically approved knowledge. And there are so many treatment options available. So please don't be a stranger. And if you are curious about the changes that might be occurring in your pelvic health during menopause, then please visit my website, www.sexymenopause.com. You can also find me at Instagram at sexy.menopause or at the Lisa Fitzpatrick. And I look forward to sharing more about this topic with you in future videos.